I'm a cardiologist, and I treat patients with a variety of different kinds of cardiovascular diseases. It was always of interest to me in medical school and learning about the pathophysiology of cardiovascular disease, but I think probably what really pushed me was when my own father suffered from heart disease when I was in medical school, and I saw firsthand the impact that that had on his life, on our family, and I also saw how much good treatment matters. When you get really good treatment for your heart condition, how the outcomes can be so good and you can make such a difference in your patients' lives. I'm a clinical cardiologist, and that means I treat a large array of patients with different kinds of heart diseases. My focus really is divided into both cardiovascular problems like atherosclerosis and heart attacks, and vascular diseases like aortic aneurysms, where I've also got a research program and national recognition in that area, as well as heart failure. And I've been interested in heart failure for many years and also recognized and do research in that area. I think that I've got a really deep and comprehensive understanding of the causes of these problems, largely because of the years that I've been practicing, plus my research interests and my extensive reading and knowledge in these areas. And I believe that puts me in a better position to communicate with my patients and to really understand them very well and to try to influence the outcome of their conditions from a medical standpoint. I think that I get the most satisfaction out of seeing my patients do well. Just something simple that the patient that we took care of who nobody thought could survive this horrific event not only survived and overcame the serious illness, but made it home, back to their family and back to their lives. I celebrate that whenever I see it and encourage my patients so much, give them hope when they're facing challenges. I see care as a partnership, really, between the team and the patient. So I'm a big believer in teams, and I believe that when you work as a team, then everybody's pulling for the same goal. And with our patients, frequently this requires a lot of education and communication with the patient and their family. I make it clear for my patients that I'm available and accessible, typically by cell phone or email if necessary. We believe in prevention. If I can prevent a patient from having to come in the hospital, if I can prevent an event from happening, if I can identify the problem early on before it becomes severe, then the patient's outcome is going to be much better. We have some really world-class expertise, and that includes in the cardiology division. We have a number of faculty members here who regularly get referrals from 2 or 3 states away for unique things that are done here or their unique expertise. So I think it always pays to start here, and it starts with outstanding medical care. It really does, and experts who know what to do and have done this before.